If you enjoy this video, please do subscribe and like down there and leave a comment for me. I would really appreciate that. And hey, I'll respond to your comment, okay? All right, let's get going then, shall we? Let's see what PragerU says about medicine prices or price transparency, how to fix healthcare. My guess, they're not going to give a solution to fix healthcare. Wild guess. Wild guess. I know. It's a wild guess. PragerU. Me? Prager? That's impossible. Let's get some captions going. The free market will fix it. I mean, that's probably what they're going to say, honestly. They're also going to say, if we just know how the price is made, then everything will be fine. Prager's not
How
published.
messed up is our healthcare system? This messed up. Researchers compared prices amongst 53 hospitals for a standard heart procedure called a CABG, or a
Cabbage. I'm sorry. It's just funny.
coronary artery bypass grafting.
Okay.
Not only did the researchers find a tenfold difference in price for the same procedure across hospitals, from
That's funny.
$44,000 to $448,000,
Jesus Christ.
but they also found no correlation between higher prices and better quality of care.
What?
Other studies have shown there can be up to a 39-fold variation in price.
It's Will Brun. Sorry, I need to. Will Brun, co-founder, Restoring Medicine.
For a simple blood test across medical centers in the same metro area. Here's the punchline. We have no idea how much we're paying for healthcare services. Why is it
Okay.
that when you need to get a surgery or medical test, you can't get a price the same way you can when you shop for, say, an airline ticket? Imagine if the airlines didn't post prices. Instead, when you bought your ticket, Delta just said, "We'll bill you after your flight."
I know where this is going. Okay, yeah, I know where this is going. They're gonna say, okay, we need to have price transparency. Price transparency, so that you know beforehand how much a thing would cost at a hospital, say this heart surgery. So then you could choose the cheapest hospital to go to, and then that will magically fix everything.
Because we don't know what the cost of fuel will be that day. Then a week later, you get a bill for $4,000. You'd scream bloody murder. Yet this is precisely what we are dealing with in American healthcare. With rare exceptions, when you go in for a back surgery or 1,000 other kinds of medical procedures, you have no idea how much it's going to cost you.
Here's a wild idea. What if it didn't really cost much at all, so you didn't have to worry about how much it costs, because you're not going to end up paying a lot, like almost nothing. Here's a wild idea.
Worse, no one would be able to tell you if you bothered to ask. That's because medical billing is a ridiculously complex dance between hospitals, insurance companies, and various middlemen.
Oh.
The hospitals charge crazy prices, $100 for aspirin, for example. And the insurance companies and middlemen agree through special, often secret deals to pay some percentage of that. That's how your knee replacement, which the hospital says costs $50,000 on its itemized bill, actually costs you $5,000 after your deductible. Out of all this confusion, one thing is crystal clear. Medical costs are skyrocketing, and Americans are having more and more trouble paying the bill. Nearly 1 in 5 of us has medical debt and collections. If you think this problem doesn't apply to you because you have insurance,
so wait, what is their solution now?
Through your employer, and therefore your costs are covered, think again. Over the past 5 years, employees have had to increase their contribution to their premiums by 15%.
So this is like really close to getting to the point of like, hey, what if we socialized medicine?
In addition to a 36% increase in deductibles. Meanwhile, wage increases have not kept up, rising 14%.
Wait a minute. This is like really accidentally left-wing.
Period. Yes, that salary increase you so richly deserved was eaten up by the increased insurance premium you had to pay.
Accidentally left-wing.
If the ever-increasing cost of medical care was reflected in the quality of the care you were getting, that is, if you were paying more to get better care, maybe this would make some sense. But as we saw in the coronary bypass example...
Wait, was there a graph for the quality? Hold on. Increase. Was there a quality thing somewhere?
There is little or no correlation between what you pay and what you get. So how
wait, what? Wait, what?
How do we get out
Okay.
of this mess? A big part of the answer is price transparency.
This is where like it's really close to being like left wing, like really close. Like, so you're not getting paid more, and your medicine, your healthcare costs more, but you don't have the money to cover that, and you're getting basically ripped off. So we should, and you're like, socialize the healthcare industry. And they're like, price transparency. You're like, God damn it. You're so close. So close. You should socialize the healthcare. That's what you should do. You should socialize it so that it's cheap for everyone. That's how it should be done.
Something almost every American wants.
What?
Even in our era of political
Wait. He said almost every American wants that?
polarization, almost 9 out of 10 Americans say they favor price transparency for medical services.
Source?
Makes sense. Market
Wait, where's the source? Where's the source for that? They said 9 out of 10 Americans. Source? Source?
only work when consumers have the proper information to make purchasing decisions.
Markets only work when consumers have the proper information to make purchasing.
And the two most important pieces of information are the price and the quality of a good or service. As it relates to healthcare, Americans don't have access to either of those. Granted, there are medical situations which don't lend themselves to comparison shopping.
Yeah, you think?
If you're in a car accident and have to be rushed to the emergency room, you're not worried about the cost. But 60% of healthcare is shoppable, meaning it's an elective.
Yeah, but 40% isn't. That's almost half. 40% is non-shoppable. Those are situations that you can't shop in. And those are the expensive kind. You can't just hand wave and say, yeah, but 60%.
Surgery, medical test, or diagnostic exam that shouldn't have much cost variation amongst providers. These services present a great opportunity to allow the laws of market competition to operate. One study estimates that $760 billion is wasted in the US healthcare system every year, with administrative complexities as one of the main culprits.
Okay.
If a transparent upfront price was offered, and most medical care could be paid for in advance just like an airline ticket, medical centers could cut a significant portion of their administrative staff that's involved in billing and debt collection.
I mean, but the problem here is that if you start saying like, oh, we just need to make the prices transparent, then what happens is everyone's going to go to like the same hospital and it's going to be overcrowded, and or if they can go there, not everyone can, obviously. This is so not yeah, prices will rise because of demand. Exactly. Like, this definitely does not solve the issue.
Furthermore, if pricing was transparent, Americans could actually start pushing the market towards rewarding those who offer a fair and honest price.
How could they
pushing out the bad actors?
How could they do that?
That, in turn, would allow more Americans to have access to healthcare. We don't need the government to take over our healthcare.
Not true at all.
Just the opposite. We need the government to get out of the way. Let entrepreneurs innovate in the healthcare space.
Let entrepreneurs innovate. Oh my God. Oh my God. Let entrepreneurs innovate. And if we just innovate, then it's all going to be good.
Whenever they do, prices go down and quality goes up.
What? Since when?
It's already happened in fields like laser eye surgery, MRI testing, and plastic surgery.
The reason why prices go up is, yeah, because technology improves and the price can be brought down, but it's not because of entrepreneurs. A lot of the stuff that happens in the medical field, for example, a lot of the breakthroughs in the medical field are publicly funded. There's public funding that funds all of the research. Not all, but I mean a lot of the research, I should say. Like, this is ridiculous. But also, Americans would still have to figure out with their insurance. Exactly, because like I've seen medicine be 30 without insurance and then be 300. Yeah, the insurance is like the main one of the main problems with the American healthcare system is that the insurance companies have completely fucked up. Yeah, make the private industry take over and try to make it even more money out of it.
Giving consumers better information always leads to better decisions. And
Source.
healthcare is no exception.
Source.
Price transparency
Source.
not only lowers costs,
Source.
but it puts the patient back in the center of what medicine is all about, helping those in a time of need. Price transparency. We all want it, so let's do it.
We all want it. Whoo! You have given me no sources on this. Everyone wants price transparency. Like, what's your fucking source?
I'm Will Brune, co-founder of Restoring Medicine for Prager University.
Yeah, something. What is restoring medicine? What is that? We are a grassroots movement of doctors, nurses, students, business leaders, and everyday citizens from across the United States that are demanding a more honest and fair healthcare system. They don't have sources in the video description. Let's see. To view the script sources. Ooh. Facts and sources. Medical debt. Rise in the waste. Healthcare is so expensive. Decreasing tax burdens on insurers. Oh my god, decreasing tax burdens on insurers? Let's see. 9 out of 10. Oops. That is not sourced here. Lack of price transparency in healthcare has resulted in wildly inconsistent and inflated costs. Researchers compared among blah, blah, blah. Studies have shown there can be up to 39-fold variation in price for a simple blood test. This lack of consistency in pricing is a result of a lack of transparency. What is this source? Wait, are you telling me I have to pay? Oh my god, they are saying... Wait. Are you... This has to be a joke. Open link in your tab. Source? Cool. Oh, it's not available in Sweden. What is this source? It's a 2019 Harvard-Harris survey found that 88% of Americans believe the government should require hospitals and insurers to disclose prices for procedures up front. And I can't view the source. The source just goes back to them. Oh, PragerU. Yo. Wait. Oh, yeah. This is what I wanted to look at. Our team. There you are. Who's funding you? So, like, we don't know where their funding comes from, which makes me really... Yeah, like, makes me really, dubious. Like, who is... Because, like, these types of things where they say, we are a grassroots movement here, this could be an astroturfed thing. An astroturfing means that, like, big think tanks or companies will set up these types of things, as in, like, we the people are trying to push for this thing. We are a grassroots movement. And then it's actually funded by, like, oil barons, and it is completely not a grassroots movement. And this could be one of those. Like, it's really hard to say. 2018, when a groundswell of students, medical professionals, and everyday citizens... Yeah, this sounds like an astroturf. Absolutely sounds like an astroturf. Rose up to demand enough is enough. The constant stories of price gouging by medical centers, predatory billing, and overcharging for medical services fueled a grassroots movement that is happening right now across the United States. This sounds like an astroturf. This, like, 100% sounds like an astroturf. Like, this sounds like 100% astroturfed. Like, this sounds like this is the insurance industry backing them and being like, hey, let's push for price transparency so we can get tax cuts. Like, that's what it sounds like. But I don't know. Yeah, anyone who blames hospitals and not the system as a whole or the insurance industry is sus. Yup. Very, very suspicious. If you enjoyed this video, leave a like, comment, and subscribe down there. I read the comments and I do comment back. Also, I stream every Monday, Wednesday, Friday, 6 p.m. Central European Time at twitch.tv/PragerU's. patreon.com/funwithfondue. Link to that also down there in the doobly-doo. And hey, have a great one, won't you?